Hello, welcome back to the channel. I'm really excited today to continue our conversation about the healthcare resolution that's coming up for the beginning of the LD season. And I'm really excited in this video to talk about negative critiques of the health resolution, or what I will call my negative critiques of health lecture. I think that it's really important to have something like this because I think that it allows you to really understand the kind of pillars for what you should be critiquing in terms of the resolution and where you should kind of be pulling a lot of that stuff from. I think a lot of the arguments that you really want to be reading on this resolution really come from the same kind of core ground and the core kind of like places where all people will kind of be pulling from in terms of how you should be thinking about not only the history as the topic pertains itself, but also the kind of stakes that are at hand when you're thinking about the future of the resolution. And so I kind of want this video to serve as a way to talk about what that is and what that kind of like means for how you should be debating out criticisms for this resolution. So I kind of want to start this off by just going through what I think are the 5 pillars of the criticisms for this resolution. This is what I think are 5 ways that you can criticize the idea of preserving health, of instituting single payer, of thinking about care from the terms of governmentality or from financialized points of view or from an individualistic point of view, and ways that you can kind of like think about where criticisms will draw a lot of their link ground and a lot of their kind of like core thesis ground in terms of what they're trying to say about policy affirmatives, and thus where you can kind of start to theorize ways that you can use these arguments to put whatever type of criticism that you want to read. Because in this video, I kind of want to talk about what the main pillars for critiquing the resolution itself is, give you some suggestions on what I think are some of like the strongest and most likely case to see on the resolution. But I definitely think that if you take the kind of pillars I'm talking about here and the ways that I'm thinking about the way they're applied to the resolution, then you have like a lot of really good weapons to kind of like put into any criticism that you would want to read. So the first criticism that I really want to talk about is the critique of life. So the idea is that like obviously single payer or healthcare is meant to institute or create and institute the idea of being able to make the good life or a healthy life more accessible to the general population. I think that there are so many arguments to make about why the question of how we're able to provide the good life for certain populations or how we're able to make life better for certain populations inevitably comes at the cost of other populations because of the way in which things like resources from, for instance, where you pull pharmaceuticals from, or how we test pharmaceuticals in other countries, or how we use historically the way in which we test medical drugs in order to create innovations in medicine, how they've been used against marginalized populations, whether you're talking about Tuskegee or other types of incidents of testing, etc. You have a lot of arguments to make about why the preservation of life is about the ability to kind of be able to preserve and stop certain communities from being able to access certain types of resources and ways of being able to kind of like think about what easy access to good life means. Because what a lot of the questions of like being able to access health means is that it changes the terms of what care is. A lot of times that when we're able to think about the question of single payer or healthcare overall, we're able to think about like the problem of a broken healthcare system that we currently have, and that the idea of single payer means that access to a doctor equals care. And I think that the critique of life is one of the things that interrupts that by saying that access to a doctor can actually mean a bunch of different things in terms of what that access actually means, in terms of how doctors treat their patients, in terms of how patients get access to certain doctors in the communities and what types of resources particular types of hospitals have, and how those funding mechanisms operate, and what it means for certain the money being pulled from certain places and other places that may mean that communities may suffer from increased gentrification and urban renewal, etc. Because increased public hospitals can also come from things like privatized investment and other ways of kind of like changing the ways in which neighborhoods operate to make them seem more healthy, right? And also, if you think about things like the COVID-19 pandemic, you think about how the kind of critique of life was about the ability to make accessible and knowable the kind of like way in which sickness perseveres all around us, so that we can kind of make better decisions about like the way in which we were kind of like operating in relation to COVID. And what does that mean for those that still had to go to work, the workers that had to go to to still serve in places like restaurants and other places like that, in grocery stores, et cetera, et cetera. I think that it's so interesting when people were saying that there was a labor shortage at restaurants and other places like that. And I saw a really interesting tweet that said that the labor shortage exists because people died during the pandemic. The numbers that we see, the blank numbers that we're able to disidentify from, are the labor shortages that are happening in necessary workers that were dying in Amazon factories, in various grocery stores, etc., from the kind of conditions of not only COVID but the conditions that they were working in, etc. From that pillar, you also get something secondary to that, which is the critique of the human. And this is kind of like separate from the critique of life, because I think that when you're talking about the critique of human, you're really talking about how healthcare operates as a way to to access things like human modification, I think that is really interesting for you to think about the way in which humanity is thinking about access to healthcare as a way to not only cure disease, but to stop the kind of like idea of stopping, human things that create human fault or human mistake, i.e., right? When you think about things such as disability, etc., what does it mean for easy access to healthcare to mean for people to be able to change the way in which we genetically morph the future or the way that we genetically morph each other? How does that change the way in which we view the idea of those that we do not identify as able-bodied, as we don't identify as fully human? And how does that change the way we think about the placement of a single payer system in terms of the way in which it institutes a singular model for how we're able to think about like what a good healthy human being looks like? Because when we're also able to think about what health is, right, obviously health isn't something that's only contextual to the hospital. Health is something that's contextual to people's environments, their living conditions, the kind of like parents that they were even birthed from, etc., that can pass on disease to them, etc., from the conditions that they were living in. And so all those things are able to mark those individuals as individually responsible for those types of conditions, instead of thinking them as conditions that are produced via our society, and conditions that cannot be, for instance, sterilized out through our ability to create easy access to healthcare. Which then kind of moves us on to what I think is like a really next important criticism, which is obviously the criticism of care. This is the criticism that's more blatant to the topic itself, but it's just that the idea that access to the care does not equal care. Obviously, like I was saying before, there are a lot of things that texture the idea of care in terms of like how doctors treat their patients, but there are also a lot of things to say in terms of how we think about the idea of professionalizing care in the first place. When we provide single payer and think about like easy access to doctors and hospitals, etc., as meaning our basis for being able to provide care in the first place, how does that desensitize us? How does that numb us and deactivate us from being able to access community-oriented models of care? How we take care of each other outside of the hospital, right? When we think about the only way for people to receive help with things like, mental health issues or various types of conditions that are resolvable, then you think about those things as only being professionalized through services such as therapy, etc. Things that rely upon the kind of conditions of services and the kind of models of delivering care that only operates from a kind of like westernized view of instituting medicine in the first place. And I think that those things are really interesting in terms of being able to investigate historically how they end up changing the way in which certain populations end up receiving care at all. I also think that when you're thinking about the critique of care, there's so much history to pull from in terms of how you're thinking, not only in terms of how doctors treat their patients, but also how care becomes a way for us to think about ways of thinking about the preservation of things like the good human, of things like the good life, and thus links itself to those criticisms before and allows you to really operate a texture basis for thinking about connecting the kind of historical basis for why we do things, for testing, the logic for how we end up at the types of medical innovations we do, and what that carries on to into the violence that we think about happens today through the medical industry. And as you think about the fourth pillar of the criticisms that I think are really important for this resolution, I think that the criticism of surveillance and data is one that is really slept on, and definitely was slept on when I was debating this resolution in college, and one I think is going to be increasingly important for the high school LD resolution this year, which is that the idea of being able to kind of streamline access to data, to streamline patient records and stuff like that, operates as a way to institute various practices such as medical hospitalizing, such as mapping out disease. When you think about U.S. pandemics response and the idea of monkeypox and the idea of COVID, the idea of the public having an easily accessible map that shows us the different hotspots of where different types of like diseases are approaching and how they are creating larger populations, decontextualizes us from the types of resources that are available to our population, decontextualizes us to the amount of vaccines, hospitals, masks available to them in order to produce, ways of protecting themselves against disease, and it ultimately allows us to produce ways of thinking about avoiding these communities, of allowing us to think of them as dirty, allowing us to think of them as sacrificable. And that streamlining of data ultimately creates a way for us to think about the extension of the kind of like surveillance service that also operates through vectors of policing, through vectors of instituting other kind of like violent practices that manipulate the way in which the population is controlled through health. For instance, when you go to the hospital for things like gunshot wounds, etc., they can examine whether or not you are wanted, or whether there was a crime that you were participated in, or draw assumptions that these things come from the same crime, etc., and use that data against you. And so public hospitals become ways in which other types of public agencies, such as the police, et cetera, are able to access things like data. And what I think is the final fifth pillar, and what I think is also another kind of subthought criticism for this resolution, is what I call the critique of democratic innocence, which is the idea that the institution of a single payer is able to do something to make us believe that there is a kind of like more socialist or anti-capitalist move that is being made by the US, even if it's like not, or if it is from a form of like tax redistribution or whatever the funding mechanism is for the affirmative. I think that there's a really good argument to make about why the kind of modeling idea that the US is becoming more socialized towards caring for populations because they're able to access single payer is a way to kind of like wave away the ways in which those types of like political agencies have been woefully inefficient in being able to address various forms of violence and being able to kind of like actually institute a much more kind of like sustainable form of kind of like care that actually steeps through the environment that these people experience, and thus allows you to have a really good criticism of how those things not only numb activism on the ground, but make things like the leadership that we currently experience more palpable, that kind of move to the middle democracy that we're currently experiencing with leftism seem like a more viable political response, and thus moves us away from other types of politics for how we're able to think about disturbing the way in which the government is able to operate in the first place, and thus really able to push you to be able to access a lot of really interesting alternatives. And so I think that some of the most likely criticisms that you're going to see on the resolution this year are biopolitics, because of the way in which because of the ways in which the ways in which the critique of life and the critique of human are able to persevere through the question of how we're able to think about the way in which certain populations are kept alive in order for certain populations to die. And then I think that the other way that we're also able to think about the critique of the human comes from the biopolitical thesis that hopefully I'll be able to talk about another time, but that you'll see in past videos that Foucault is really drawing about in terms of how the normalization of things like the Vitruvian Man, etc., like create the kind of like thesis for like what we strive for care to be. I thus think that also things like capitalism, critiques of anti-blackness, disability, and gender all become intertwined and really interesting criticisms that are able to like weave into the different pillars of the criticisms for the resolution, and are ways in which you could think about like ways of instituting critiques of care, surveillance, data, and democratic innocence in ways that are really interesting and allow you to read things like the Black Madness literature and other literature that has really been proliferating in popular ways to create really interesting criticisms of the way in which care becomes financialized and professionalized and streamlined in such a way that the way that we think about care becomes only through these public agencies, instead of one that is actually able to think about the protection of those total environments for care. Thank you so much for watching this video, and hopefully you'll tune in more stuff that's coming on the channel. And yeah, thank you always for tuning in.